I'm Dr. Esther de Gorville, and I'm the country representative for the World Health Organization and the Pan American Health Organization here in the Bahamas. And my colleague, Dr. Gabrielle Vivas, is our advisor on health systems and services. I'll start by saying that the Pan American Health Organization and the World Health Organization extend our sympathy to the people of the Bahamas on the devastation that has taken place on the two islands of Abaco and Grand Bahama due to the passage of Hurricane Dorian. The PAHO and WHO are working with the Ministry of Health to save lives and protect health. We are here to help the government to secure food supplies, safe drinking water and sanitation to respond to the crisis that's unfolding in Abaco and Grand Bahama. We already know that a number of health centers and health facilities have been severely damaged due to flood and the effect of strong winds during the hurricane. We are still assessing how many facilities can be made functional in the short term. And at the moment, we are operating the Ministry of Health through the Marsh Harbor Clinic on Abaco, and we are the Rand Memorial Hospital is still maintaining some service, but not accepting new patients. We know that the death toll is already 20, and the Ministry of Health and national authorities will update numbers as the situation unfolds. PAHO and WHO are providing urgent assistance to meet the health needs of the thousands of persons who have been impacted by Hurricane Dorian. Given the disruption of services on the two affected islands, we're supporting the government in ramping up the health response to the disaster. We stand ready to assist the government to meet the demands for health for the affected population, and we are organizing assistance to meet the urgent needs. Our organization has responded by increasing our surge capacity, and already on site within the island, we have expertise in communicable diseases, in logistics management, in epidemiology and public health, and we are also helping to mobilize emergency medical teams to complement the services and integrate the services with the Ministry of Health to meet the needs. Two teams from Samaritan's Purse and Team Rubicon are providing full hospital capacity service to respond to the needs, particularly since Rand Memorial Hospital cannot be fully functional at this time. We have a number of key priorities to address. We do not want to have a second wave of a crisis, so we are trying to avoid outbreaks of waterborne and vector-borne diseases, of which there's a high risk because of the extensive flooding that has taken place and the compromising of sewage systems. We see this as a response that requires our assistance for maybe a couple of weeks, if not a longer term, and we're committed to helping in whatever way we can to carry on our technical cooperation with the government of the Bahamas and the support that we're providing to the Ministry of Health and the National Emergency Management Agency.
I wanted to ask, do you think government at this point should declare the situation a national emergency? Because what we are hearing from a lot of organizations like yourself is that, they stand ready to help, but are waiting on the request of government. And we have a lot of entities saying we're waiting to get the green light or to go through some of these bureaucracies to give the help, and they're unable. So it's kind of turning into a frustrating process for persons who say they, quote, stand ready.
Okay, I need to clarify that PAHO and WHO are not standing ready. PAHO and WHO have a country presence within the Bahamas, and we've been here for over 40 years working with the government. Even before the hurricane impacted, we were working with the national authorities on preparedness activities, anticipating the level of damage and the health responses that will be required. Most humanitarian agencies and non-governmental organizations are already on ground in the Bahamas, at the National Emergency Management Agencies, and NEMA is coordinating the responses that will be required. Clearly, at this initial stage, our focus has to be on search and rescue, helping the people who have been made homeless because of this crisis, evaluating the infrastructure, and making arrangements for their safety. I think all agencies will have an opportunity to contribute to the effort, and that we don't necessarily need for the declaration of an emergency. Remember, the Bahamas is an island archipelago. These are only 2 of all of your islands that have been impacted. Nassau, New Providence, is the home of over 75% of the population of the Bahamas and has not been severely impacted by the hurricane. So I think the government is doing a tremendous job in responding to this crisis, and the coordination that is being done by NEMA is unparalleled. I think they're doing a very good job. So I would encourage you to be supportive of the efforts. The focus right now is on saving the lives of persons who survived this hurricane.
With persons on the ground here too, can you tell us about the level of injuries and what kind of help is needed from the health standpoint?
From the health.
Could you just tilt the mic a bit?
This one?
The next one. Yeah, just tilt it forward. Just tilt it. Tilt
The top.
Put it down. Put it down.
I'm aware that the Ministry of Health and NEMA are in collaboration with the U.S. Coast Guard, and that they have already started airlifting the patients in need of the most urgent care are being airlifted to New Providence, where their needs are being looked after. At the moment, there is not wide-scale ability to access areas that have sustained substantial damage on both islands. But as the situation evolves and NEMA is able to put boots on the ground and to have rapid assessments done, we will see more persons being evacuated, possibly to New Providence. The government has to make that decision. But in terms of the healthcare needs, we are positioning ourselves with Ministry of Health to respond already to the healthcare needs. I'm aware that approximately 100 patients have already been airlifted from Abaco, majority of them from Abaco, and that those arrangements, that airlifting arrangement still continues.
What advice can you give persons who are still on the ground trying to, I guess, quote, survive? You have open water, still water, have a little food, that sort of thing, and persons, besides what we're hearing, it's a really desperate situation.
Clearly, it is a desperate situation, and stocks of food and water are being made available and will be delivered to the affected islands. There is a British vessel that is already positioned and providing water to persons who are on Abaco, for example, and within a day or two, you would see increasingly the ability to operate on the ground in those 2 islands and to provide the much needed relief that persons need. Arrangements are being made through, for example, United Nations agencies and other humanitarian agencies to secure food and water supplies and emergency medical equipment and emergency medical supplies for the affected population.
Could you talk a bit more about the waterborne illnesses that you were mentioning? In light of the wide-scale devastation, lots of flooding, what are the kinds of illnesses you think are fester?
Well, you would have, due to the extensive flooding that has occurred, and there's likely to be sewage contamination of the water and the water that is stagnating on the ground now in many locations. In that situation, we can anticipate waterborne diseases and foodborne diseases. Waterborne and foodborne diseases, waterborne will be diarrhea diseases, and vector-borne, we run the risk of things like dengue fever and other infectious diseases. We are not standing idly by. We are prepared to ramp up the responses. to reduce the risk of outbreaks of these diseases. We are issuing public communication messages for the safe handling of food and water. And when food and water is delivered to the persons in need, they will be prepackaged so that there would be no need for people to be cooking or handling water to consume those items. So in the immediate aftermath, messages are being sent out on food, unsafe food handling and safe water, how to make that safe.